Hi, I'm John Hagan, co-host of Shift by Alberta Innovates, our podcast with a focus on Alberta researchers, innovators, and innovation. In the fall of 2020, Alberta Innovates announced $2.1 million to go towards research and innovation projects looking to slow the spread and lessen the impact of COVID-19. Today I'm speaking with Dr. Ken Parhar, Intensivist and Clinical Assistant Professor in the Department of Critical Care Medicine at the University of Calgary. His was one of 7 to receive Alberta Innovates funding. Welcome, Dr. Parhar.
Well, thank you very much. I'm very pleased to be here, and also thank you to Alberta Innovates for funding our work.
Now, Ken, intensivist is a really hard word to say, especially if you try to say it 5 times fast. It must be even harder to do. What is it? What's an intensivist?
Well, it sounds very intense, but just like the name states, but our job is to provide life support for patients that have catastrophic injuries to their lungs or to their heart, and they're unable to generate blood pressure. So it's really about providing the basics of what has to happen to keep patients alive. So that involves using things like the ventilator, which I'm sure most people have heard about, especially with everything going on. But it also is important for us to also discuss what is appropriate and inappropriate for patients to get given their current circumstances and also with their wishes. So we spend a lot of time making sure that we provide the right therapy for the right patient.
Can we dive a little bit into your project that you're doing, that Alberta Innovates is funding and supporting? Can you describe that in lay terms for us?
Absolutely. So the project that was funded by Alberta Innovates involves patients, obviously, that have COVID-19 disease, and they're specifically patients that end up in the intensive care unit where we provide life support. And as many people are aware, COVID-19 affects the lungs, and it can cause a syndrome that we call acute respiratory distress syndrome. And we call that ARDS for short. And what that means is that in addition to causing an infection of the lungs, it also causes inflammation of the lungs. And what ends up happening is that your lungs are not able to do the normal job that they usually do, which is to provide oxygen to your body and to clear carbon dioxide. When that happens, we have to put those patients that develop bad COVID-19 ARDS onto things like mechanical ventilation. We have to put a breathing tube in through intubation, and it can be quite an intense process for that patient.
So what are you trying to achieve with your research?
Yeah. So when patients come into the intensive care unit and they have COVID-19 acute respiratory distress syndrome, they end up on the ventilator. And what we know from previous research is that how we position those patients or how they lie can actually influence whether they recover more quickly or less quickly. From previous work, we know that putting patients on their stomach or proning them while they're on a breathing machine when they have severe ARDS can actually help save their lives. And in fact, a study from almost 10 years ago called the Perceiva study showed that for moderate to severe ARDS, if you prone position 6 patients, you will save an additional 1 life out of those patients. So it's a really important technique that we could potentially be using in order to help these patients. Now, the problem is, although it sounds simple, lying a patient who's on life support or on the breathing machine is not an easy task. The actual act of putting them on their stomach can be tricky. You always worry about tubes and lines that are attached to the patient falling out and causing a life-threatening problem. So it takes a lot of skill and practice, and it has to be done in a team fashion involving nurses, respiratory therapists, in addition to physicians. Our project is looking for ways to improve our ability to apply this technique. When we look at our use of this technique in Alberta, it's low, but that's not a problem that's specific to Alberta. It's in fact a problem that's worldwide. Prone positioning is underutilized, and the reason it's underutilized is because it's tricky. It causes a lot of anxiety amongst care providers, particularly if they're not experienced. or if they haven't practiced the technique. So what we're doing with our research project is we have a toolkit that we will be introducing to every intensive care unit across the province to help increase the rates of prone positioning that is appropriate and safe to use.
Okay, but have you done it? Is this
Absolutely. So during the COVID pandemic, we've been using prone positioning quite a bit.
okay?
And but without practice, it can be quite anxiety provoking because you've got a really sick patient, they have a breathing tube in their mouth, and now all of a sudden we have to flip them over onto their stomach, and that can obviously be quite challenging if you haven't
Sure.
practiced that before.
How is this turning out now? What sort of results are you seeing?
So at this time, where we're at in the project is we've finalized our toolkit, and we're just in the process of introducing it now out to each of the ICUs. Our hope is that once we introduce this, we'll continue to work with each ICU to help build their capacity and their comfort to prone position. And the idea here is that the funding that Alberta Innovates provided us, it was really important to pay for a knowledge translation practice lead who actually will in fact help teach this toolkit to champions at each ICU in the province. And what that will hopefully allow is for patients to get this important life-saving technique in an ICU that's close to their home and potentially save their lives, and also prevent an unnecessary transfer to a site that may be farther away from your home community. That's part of the toolkit, in fact, is actually to provide, we call it audit and feedback. We show people how they're doing, where their rates are, and where there's opportunities for improvement, and hopefully that will motivate them to get even better. And when you have the opportunity to compare yourself with other intensive care units, I think it's quite a motivating
Sure.
way to deploy that. So we hope that with a bit of spotlight on that, we can again make sure that all the right patients are getting the right treatment, which in this case is prone positioning, at the right time.
Dr. Parhar, this is fascinating work you're doing, and we're eager to hear more about it. Thank you very much for your time.
Thank you very much for having me, and thank you to Alberta Innovates for funding our project on behalf of all our patients.